Alhamdulillah wa kafa wa salatu ala ibadihi allazina astafa. Assalamu alaikum wa rahmatullahi wa barakatuh. Let me just give you a bit of background about who I am, because there's something about what's in the biography and there's something about what I really want to say about who I am. So I'm initially a physician, okay, a GP. I went through a number of rotations in surgery. I did a few different things and ended up becoming a GP. And the reason why I became a GP is because of the flexibility that I could study. So I studied for a number of years in a seminary. And one thing one of my teachers said to me was, Dr. Saab, when you graduate from here, beware that people will ask you regarding questions related to medical fiqh. So be prepared. So right early on, I've always made notes on those things that really crossed those areas which were important to me. And I don't know if Dr. Zubair Mullah is here. Is Dr. Zubair Mullah here? Has he gone? Yeah. There you are. So Dr. Zubair Mullah and I came together and started really thinking about this. Dr. Zubair Mullah is a consultant anaesthetist. And we then first organized the conference that you're referring to in 2006. But anyway, the main thing is that I've gone through a real journey from two particular perspectives. One, from the seminary or Islamic seminary perspective, and the other as a physician. And it's interesting when I sit there and I listen to conversations between the two, how you see how people frame questions and how people respond. And I want to demonstrate that to you, and also demonstrate something very, very important in terms of the fact that the field of medical science is expanding immensely, very, very quickly. And it's impossible for one individual to become a master in that particular field in itself, but rather it has to be something which is a collective thing, a multidisciplinary approach. And I'll talk about that as I talk about the whole scenario. Okay, right, now, let me start off. Okay, let me start off by first going onto this slide here. There's three particular main focal areas that I think are essential that we need to focus on as a collective group. So this is not just about ulama, because reality is, just like Mufti Zubair was mentioning earlier, and I couldn't say it any better than this, because I've sat down with philosophers and I've sat down with people from anthropologists, and they are just as diverse in their verdicts as ulama are. So this is not unique to ulama. Okay, this is the first thing we need to accept. The second thing here is there are three particular areas that I feel are gaps that need to be filled. The first is there needs to be some well-informed research. So that's about ensuring that the gaps in current medical fatwa are dealt with. There are gaps there, and clearly they've been outlined by some of the academics earlier on, and it's not like the ulama don't accept that. They mention there are gaps. Mufti Zubair has just clearly outlined what those gaps are. Second, there has to be research impact. So, okay, you've got a final product. That product has to have impact. If it has no impact, it's just words on a paper. Nothing more than that. So that impact is absolutely essential. So how do we ensure that those gaps are addressed? Third, learning, teaching, and training process. Learning, teaching, and training is learning, teaching, and training. It's not that individual is no longer able to deal with it, let's remove him from that role and put somebody else who we think can deal with that role. When it comes to fatwa, let's be honest, at the end of the day, the people follow the ulama. It's always been like that. It is, and it will remain like that. Reality is the ulama need to be informed. Just like you go into any kind of, I've been in a number, I was a commissioner for the NHS. I was a board member as a commissioner for Bradford City CCG, and I did that for 6-7 years. Now, my role was that I would sit there as a commissioner, and I would have intelligence brought to me from a number of different ways. So I had somebody who was very heavily focused in patient engagement. I had somebody who would inform me about the prevalence and public health figures and general intelligence related to prevalence of disease conditions or where I need to consider my priorities. And with that informed sort of decision-making process, I then came to a conclusion. And that was a verdict, and that's how things moved forward. And that's how it worked. And the ulama's role is exactly the same. So in that respect, Dr. Ghali clearly explained how the fuqaha in history they actually went back to the primary sources and started studying those books. That isn't to say they were experts in it. They made reference to experts. So that was a process that was always there. It's nothing new. However, we need to recognize that these sciences have developed considerably over time. So when we look at those sciences, let's look at well-informed research. This is how fatwa related to medical fiqh is presented. The fiqh, that's there. So we make reference to our kitabs, our books on fiqh. We have usul al-fiqh, and we need usul al-fiqh because that will do is provide a trajectory to allow us to understand how all cases can be presented in the new world. Biomedical science. Biomedical science is clearly a number of individuals who will inform us about what the current state is of medical science and what things we need to take into consideration. Now, so this is the process. The process is you have the fiqh literature. This is where it could be going. Fiqh literature presents itself in book form and through what one learns from teachers. Now, if we were to unpick the fiqh literature, you will see that the fiqh literature is contextualized. And this is something that I have been seeing more and more as I go further and further into this research area. You have the Quran and Sunnah that is made reference to in the fiqh literature. You have secondary sources like ijma, qiyas, and so forth. Then you have a methodology, an approach to those sources, which relates to a madhab. There is you can say a metaphysical approach, you could say some kind of approach in terms of how they do istidlal from those sources. So that may be a theological background. So there are certain theological things that scholars from a different madhab sign up to, even to address the absolute principles related to their fiqh. Ontological, metaphysical, epistemological. I'm going to make reference to that in a short while. But then there's a piece it doesn't exactly fit, but yet it sits there. And you realize that that's what was the understanding of medicine at that time. So in other words, the ulama, they took on these sources and then they came out with their conclusion. Those conclusions have been recorded in the books of fiqh. So reality is that work has been done in context of the time that they wrote that fiqh. And that's a really important thing to understand. How do we ascertain which aspect of that was knowledge that was solely in the domain of science and the understanding of science at that time relative to today? Now, this sheet is quite heavy, and I've deliberately made it heavy just to demonstrate what well-informed research is. So let me just quickly browse through that and just explain some of the things. Theology. Where does theology come in? Qadr taqdeer. So this is a question of questioning the idea of fatalism. Yeah? Am I more pious when I have tawakkul? I do not take on the asbab, the means. So if I don't take the treatment, does that mean I'm more pious? These questions are addressed in theology. Then there's a question of epistemology. And epistemology basically has to be addressed because there's a question of quantifying certainty. So I was talking to some of my students not too long ago. So you'll see there are different approaches to the idea of dhurura. So Allama Hamwi, he has an understanding which is much more conservative as relative to Imam Shatibi in his Muwafaqat, which is more liberal in its approach. But reality there is, how do we relate to that in terms of giving it epistemological value? How do we quantify that? Because when somebody is in the state of ittirar is somebody who is starving to death. And therefore, the only solution for them, if there is porcine there, they would have to take porcine just to survive. What does that mean for us today? How do we quantify that? Is that 100% certainty that he's going to die if he doesn't take it? Is that 98%? These are things that we need to explore. Then there's a question of, so this is question mutayaqqin, madnoon, and mawhum. You have different gradings of levels of certainty. The other questions would be, when we look at the concept from an individual perspective to community, we have figures and statistics that can give us a good indication of probability from the research that we've done and give us a very good account of a trajectory of what's going to happen to us in 2 years, 5 years, 10 years. Organ transplantation is a good example. What's the survival rate of somebody who has an organ in 5 years, in 10 years? The ulama, in some of the fiqh literature, they did not have that knowledge. They used anecdotal knowledge. Anecdotal knowledge. If I was to go to an alim and say, there's a village in Pakistan where 60% of the people there have an incision here, that mufti is going to turn around. That is not permissible. This is anecdotal information. But now we have the knowledge to be able to go into the detail, to be able to give us quite an accurate account about the concept of certainty. How do we relate to that? Then there's questions of ontology. So this is we talk about darar, la darar wa la dirar. And we also talk about mushaqqa. Mushaqqa tajlib al-taysir. We talk about these concepts of harm and necessity. But how do we quantify that? How do we know? Is it subjective? This person's going to go in harm, so for that reason he's excused. This individual is not going through harm. These are the kind of questions we need to address because we need to have that level of quantification so we can address this from that particular perspective. There's an apparent conflict between medical science and what is apparent in the transmitted sciences. So Mufti Zubair has clearly outlined that in the issue regarding embryology. So when you look at the his aspect, when clearly you can see a fetus a very early embryological stage at 140 days has what we call takhliq. Arms are visible, legs are visible. How can you say that this is not going to happen, or this is only going to happen at 120 days, when you can visibly clearly see it happen in front of you? We've got the ability to be able to do that now. So these are kind of questions that we need to address. The other is metaphysics. So this is where we sometimes have to go into ilm al-kalam, because ilm al-kalam is the only part where the scholars and these fuqaha have even discussed these issues. So because a lot of the fuqaha, early fuqaha, were experts in ilm al-kalam. So they have discussed these issues. So there are things, for example, about consciousness, volition. At what point do we say which part of this consciousness is the soul? These are very, very important questions. We need to address these questions. There's also anthropology. People had different worldviews. We have a more reductionist worldview now. So when we see things in a material form. Do we look at the soul as a number of neurons engaging with each other, transmitting all sorts through each other? Is that what we consider as the soul? A reductionist view? Or do we see it as a whole? Something much in a metaphysical world that actually engages with the body and has some kind of impact on the body. Ethics and taklif, obligation, the concept of obligation. Who has the agency to make decisions? We have the Mental Health Capacity Act. How does that reflect on us? Because when we make reference to this, we talk about who has taklif to actually go and read their salah. Who is it mandatory on? Who is it obligatory on? So this is a question of agency. Then there's also an understanding of biomedical science. And from there, you're looking at understanding the anatomy. Very clearly, in the fiqh books, it will talk about issues, for example, if a woman uses a vaginal pessary, her break will fast. It says that in the Hanafi fiqh books. Okay, if she uses anything along those lines, it'll break her fast. But then if you look to the principled approach, you realize that the understanding of the anatomy at that time suggested there was a manfaz al-mu'tabar. There was some kind of connection between the vagina and the digestive system. That was the understanding at that time. We recognize that doesn't exist now. So does that change the ruling now? So there are many, many little questions like this that need to be addressed. So you can see the future of medical fiqh research requires a multi-science approach. That's something we cannot escape. It has to be done. Now, the other thing is the way it's dealt with. So you have the Muslim jurist and the physician misappropriations. Okay, so this is how it works. And this is my observation. And Asim Padala and I have discussed this a number of times. But when you have physicians, what physicians do is they already have an agenda most of the time. They have already come to some kind of conclusion. So they frame the question in a way to a mufti. And then the mufti's role is to get that information and see how it fits in with the fiqh literature. See how it fits in with the whole framework of what they work from. And that's quite a mission for them to do. So they need to be very acquainted with that. So you can see how there can be serious misappropriations there. Research impact. Right. There's two types of impact that are essential. One is academic impact, where it has to demonstrate a contribution that excellent research makes to academic advances. So ulama have a role to ensure they inform the bioethicists, the Islamic bioethicists. It's their role. They have to do that. They have to engage with them so that they can have an impact on their work. So it's not just the fact that bioethicists should have an impact on ulama. Then there's a societal impact, and this is about people. How do their fatwa engage with people? We've had a lot of discussion about that all day. There are current barriers and issues, and we need to address these barriers and issues. They exist. So we have silo working. Many muftis work in silo, as individuals or amongst own groups. So you can be thinking to yourself, I'm working in a group. There's 10 of us. But reality is you all have the same mind frame. You're working and thinking exactly the same. There's no element of realizing or learning from others. Too impractical. We're very theoretical sometimes. So there needs to be some pragmatism there. And that will not move people to action. Reactive versus planned. We tend to be reactive. Okay? There's a new law out regarding organ transplantation. Mufti Zubair, you must produce something within so much time. If you don't, we're in trouble. So there's an element of reaction rather than something which is planned. Too narrow. Sometimes what we do is we focus on certain things in the fiqh literature, and we focus so heavily in that, going into so much gross detail, we miss the bigger picture. Yeah? And that's happened a number of times. So too top-heavy. There's always a top-down approach, or there is most of the time. This needs to be bidirectional. Ulama need to engage with the people. They need to understand what dharar means to them, what harm and hardship means to them, so that they can then have that level of not empathy, but also a recognition of what that means. Too little long-term commitment. We don't revisit our fatwa. I wrote a fatwa 10 years ago. I give Mufti Zubair a lot of credit because he's somebody who revisits the same thing again and again. But there are many times we've written, I wrote a fatwa on this 15 years ago. Go read that. How times have changed. The whole literature around fatwa is continually developing. And it will not stop. It will never stop. It will continue to develop in every science because there's new knowledge that is appearing. These are some of the opportunities for multidisciplinary working. I'm not going to go into the detail. And some of these, by the way, these slides will all come to you guys via your emails. So, but you can already see there's a lot of opportunity. Let's think positive about this. There's a lot of opportunity for collaborative research, collaborative training, people and information exchange, wider resources that we can use. Ulama don't have those resources, but if I sit down with a couple of bioethicists, they will bring a lot of resource to me. Engaging wider cultures and approach. There's different types of cultures out there. We need to realize which culture we're framing this fatwa in. Funding opportunities, there needs to be a funding opportunity for a Muslim scholar. I know many very, very knowledgeable muftis, and they have to work in their shop because they have to make an earning. But it's a waste of a talent. Increased impact and greater opportunities. Learning, teaching and training process. Now, this is one of the objectives of Al-Balagh organization. We have online courses. So what we're trying to do is we're trying to get the physicians and the clinicians and academics to engage with the ulama. And the only way to do that is you have to train them up together. You can't train ulama alone, and you cannot train physicians. I'm saying this solely with my experience. If anybody has an issue with it, you come and talk to me, right? Because I've seen this happen again and again and again. They talk a different language. You have to train them together. Al-Balagh, we do this. We train everyone together on the same platform. They engage with their teachers, and the teachers, as teachers, we're learning all the time. So we learn, they learn, you come to talk the same language. That is a way that you start realizing when I frame my question to a mufti, I have to frame it correctly. I can't just come out with this and that. So you come into this dialogue between a mufti and an academic, or a mufti and a physician, and the wires are just completely crossed. They're just not engaging. Then we've got online courses level 2, which is more specialized. This is about addressing training needs and the skills. It's not just about knowledge. This is about skills. So if I have a lot of knowledge, I have many my teachers who are oceans of knowledge, truly, but they're not articulate without knowledge. That's not a negative thing. But sometimes there's a way of framing knowledge to somebody. And in the kind of political world that we live in today, you have to be very careful how you say things, right? So for that reason, they either avoid it, or there is a need for certain skills to be able to articulate certain things in a certain way. But yet you can sit down with them and they really appeal to you. And then the other element is contributors or collaborators. So our level 3 is focused about getting these people round a table and let's do some work now. You guys have been trained up, you got the skills, we need to get you around a table and let's do some serious work together and start looking at all these different areas. We require philosophers, we require anthropologists. But reality is, when you go through this, and so there is a real focus on ulama training, because we, in essence, from that particular perspective, a lot of our students are ulama. So we're looking at a takhasus program, which goes around, that ensures knowledge gaining knowledge in this particular area, and skills and competencies. Public engagement. We need to get every one of us to engage with the public. Network portfolio. It's about apprenticeship. They need to have some kind of apprenticeship and experience, and then higher academic studies. So we're in the process of trying to organize a master's degrees for some of the ulama to become specialists within that particular field. So this is one of the conclusions that we've come to. We need a Dar al-Ifta al-Balagh. And Dar al-Ifta al-Balagh solely focuses on medical fiqh. And the idea behind that is we recognize there are certain responses which are simple, all agree, and easily accessible. For example, when is a person ma'zur because he has a catheter? So the issues of purity, very straightforward questions. But then there are very complex questions which require them to engage with a multidisciplinary team. It requires a complex response, and there may be disagreements, and it's not easily applicable. So there's a process or a format of response. So you have a fiqh research, you have a multidisciplinary approach, then you have to frame it for the different consumers. NHS bodies, they require a different approach in how you articulate that relative to a family member. Muslim scholars and imams, you talk to Muslim scholars and imams differently to what you would do with the NHS bodies. Muslim organizations, they need a different approach. We've seen examples of that today. Medical professionals, you talk to medical professionals and you have to produce something that they're familiar with, like clinical pathways. So we have clinical pathways, we're very familiar with that. Just the same way GMC has its codes of conduct, it has to be framed in something that they are familiar with. So the idea is recognizing, now this picture is very important because what this is showing is you've got the muftis and the ulama at the center, and that is essential. You need muftis and ulama at the center, because at the end of the day, if you are a bioethicist or you're a physician, you go into a mosque and you tell the people that organ transplantation is permissible, you're going to have problems. People are not always going to accept you, because a conclusion or a verdict is not just about research and knowledge. It's about trust and it's about taqwa. And you'll find patients sometimes, or not patients, but the Muslim public, what they do is they trust a scholar. And for that reason, they say that even if maybe he hasn't come to the right conclusion, the main thing is that Allah has placed this individual in front of me, and this is the verdict, and if I act on that particular verdict, then that is my job done. And this is the viewpoint of many. Okay? Now, recognizing that the Muslim community is not homogeneous in that way, but there are differences amongst them. So there's a process. This is a proposed process. So let me just take you through this process. It's not just about something we've been pondering over, we've actually thought of a process, but this is something that's in work in progress. So you frame the question, but the way you frame the question is you identify an area of research. There's an area of research that needs to be done. Very, very important. You must frame the question appropriately. Then you assign areas of research. So that may require you to approach a bioethicist and say, can you do some paper and research on this? You go to a mufti, say, can you do some research on this? You go to an anthropologist and say, can you do some research on this? And you get them to bring their work together on one platform. You present their research and they are peer reviewed. So all this is peer reviewed amongst them. You finalize the research, so you come to some kind of conclusion. You may have a difference of opinion, fair enough. And that's nothing bad. That shows that people are going into many different areas. They've got different approaches to that concept. And then you have a final appraisal and a position paper. Now, I really feel that fatwa, the way they are written, they must change, especially in medical fiqh. It has to come to a position paper, especially with issues which are quite complex. And that position paper is something that as a collective of a multidisciplinary team, you come to some conclusion. But that position paper has to be signed by a mufti. The mufti's signature is the most essential there, because this is something which is considered Islamic in that sense. And that is where the authority lies. But yet it has to be an informed mufti. A mufti who is informed, who has the skill set to be able to deliver appropriately. So we do this in every field. I'll just talk to you about my role as a commissioner. I was given many, many different forms of intelligence, and I had to make a decision. The mufti has a similar role. You have people of different specialities. They will sit down, and you see if there's gaps in their understanding, because they're not accustomed. They have a lot of knowledge. We can't deny that. But their knowledge is focused around the things that they're experts in. Just like one of you has a lot of knowledge in your expert area. Doesn't mean you don't have a knowledge in everything. They're only human at the end of the day. But the reality is that there is training need, and we have to accept that. There's training needs in all of us, that we all have some kind of basic understanding about a subject that we can then ponder over and then draw informed conclusions. And then that presentation of the format for different stakeholders. Then once that is done, that needs to be produced as guidelines for clinicians, as a policy paper for NHS organisations, as a literature or even infographics for the public, something that they can see and they can visualise. They don't have to read a paper. And that will allow them to be informed about what Muslim scholars are saying, who are informed. Thank you. I'll finish on that note. Jazakallah, beat you to it.